I am Dr. Shubharti Kaur. I am a nephrologist working in the Department of Nephrology, Silet MAG Osmani Medical College, Bangladesh. And I am also a member of the World Congress of Nephrology Social Media Team 2021. And it is our interview session. I am here with the speaker. Our speaker is Dr. Parisa Rashidi. She is an associate professor of University of Florida. She works on AI, and she is a graduate from Tehran. And I would like to ask Dr. Parisa Rashidi about her journey, about her academic journey from Tehran to Florida.
So to tell you how I started with AI, I was fascinated by AI starting in my undergrad years, going back to University of Tehran in early 2000s. I remember back then in summers just borrowing AI books, going through them. And of course, back then it was a little bit different. AI wasn't as popular as is these days. And there were no online lectures, YouTube posts, blog posts, or tutorials like today. But it wasn't really until my graduate years that I realized that not only I like AI, but I love AI applications in the medical field. So during my PhD study, I was working on developing AI and machine learning tools for monitoring cognitive and physical function of Alzheimer's patients in a non-invasive manner in their home. And that kind of morphed into what I'm doing these days as a faculty member at University of Florida. And we are using AI tools these days, not so much in the community setting, but more in the acute care settings. And we are using that to monitor patients.
Thank you. What your lab is working right now?
These days, well, my group is working on developing machine learning tools for monitoring patients in the acute care settings, more specifically in critical care and also perioperative settings, before surgery, during surgery, after surgery. And we have a couple of exciting projects. One of them is using machine learning, computer vision, pervasive sensing for monitoring pain and agitation in patients who are in the intensive care unit but are nonverbal. For example, they might be intubated. We also use these tools for monitoring their physical function, mobility of patients in critical care settings, which could be a really important indicator of their recovery. On another project, we are working on tracking the recovery trajectory of patients in acute care settings. And we try to use machine learning tools, deep learning tools in order to predict their trajectory over time based on physiological signals, based on clinical data. And ultimately, we are trying to also embed these tools into a clinical real-time system, which is really challenging, but I think it has lots of promise. We cannot just do this as research. At some point, it needs to be taken into the actual practice, and it has to be translated. And of course, in all of these projects, we also look into some of the important problems such as fairness, bias, and equity when you're using AI in these kind of settings.
Thank you. How far AI will make independent clinical decision without human interference?
So I don't think that we will ever have AI systems that don't have humans at all in the loop. I think that humans will be always present in that loop. And those tools, basically, they will allow the clinicians to augment their decision making. So to help them facilitate the clinical workflow, to make it easier. For example, pain assessment in the ICU or physical function assessment, it needs to be done every couple of hours by the ICU nurses, which they are already overburdened with so many tasks. They have to do that over and over for all the patients. Now, we are not suggesting that should be completely replaced. What we are suggesting is that that should be augmented, that should be automated to an extent that they can take care of the other tasks. And if needed, they should be alerted that while the system is not able to detect something, and so the human in the loop will come and take over. So that's how I envision AI in clinical systems, that you will have automation for facilitating the workflow, but still you will have the more high-level decisions being made by humans.
Thank you for updating. So the doctors will not become jobless in near future due to AI.
No, I don't think that will ever happen.
Thank you. Can you give us a glimpse of your talk during upcoming World Congress of Nephrology?
Sure. So in my talk, I will discuss how AI can improve equity in healthcare, and more specifically in nephrology. At the same time, I will also explain how AI can harm equity. And I think that's very important because these are the two sides of this story that we need to keep in mind. And I will also talk about a little bit about some of the guiding principles, some of the design guidelines that we can use in order to address some of those challenges. Again, this is a very new and emerging field, using AI in clinical decision making, in nephrology, and there would be issues in terms of safety, in terms of bias and fairness that we will see in the future. And I think educating and training researchers in the field as they are entering this field, that can be really important, and we all need to have conversation around this topic. So that's what I'm trying to do in my talk, to provide a broad overview of how AI can be used for improving equity, but at the same time, how we should be aware of some of the problems that it might also create down the road or in short term.
We'll be eager to listen to your talk in the upcoming Congress. Thank you so much.
Thanks for having me. Thank you.